Oh, sorry.
Okay, so my Mar's on the computer because I don't have a printer. Okay, so first of all, I'm going to go into my patient's room, knock, and I'm going to verify that this is Susan Anderson. And I'm going to grab her vitals because she needs a set of vitals before I give her any of her medication. So Susan, I'm just going to take your vital signs. Is that all right with you?
Yep.
All right, perfect. So I took her vital signs, and now I'm just going to go and dish up your medication. I'll be right back.
Okay.
So then, now I'm back at the computer, and before I've done any of this, I've compared my Cardex and my MAR to make sure that all of my medications are exact and the same. And if they weren't, then I would have compared them to the patient's chart, and if they were, and if I had any other questions, then I would contact the physician or the pharmacist on call. So now I'm back at the computer, and I'm just going to give her all of her 9 o'clock medications, and I'm going to give her her Cardizem, Prednisone, and Valium, and her Lasix and Digoxin, and that would be it. And if she needed any PRN medication at this time, then I would have asked her once I was taking her vital signs. So then I'm just going to compare the 5 rights with the MAR since it's accurate. I'm going to compare the dose, the medication, the patient, the route, and the time, and I'm going to make sure that's all set. And once I'm done with that, I'm going to dish up my medication. And I'm going to pour it into the cap and then into the container. And then if they come prepackaged, I would not take them out of the packaging. I would take the packaging into her room and make sure that I would dish it up there. And then I would take my dished medication, and I'm going to take my MAR, and I'm just going to make sure before I give her her medication, I'm going to make sure that all of her medications can be taken at the same time, and that if they need to be taken with food or with water or on an empty stomach or a full stomach. So I'm going to knock, and then I'm going to ask Susan, may I have your birth date?
9993.
And then I'm just going to verify on her armband to make sure that it's correct. And I have all of your medication here for 9 o'clock. Would you like to know what they're for?
Yes, please.
Okay, so I have your Cardizem, and that's for your heart. And your Prednisone is for your COPD. And then I have your Valium, and that's for your anxiety. And I have your Wellbutrin, and that's for your COPD. And your Atrovit and Albuterol, and those are both your aerosols. And then I have your Lasix, and that's just a diuretic. And then your Digoxin, and that's for your heart as well. And are you ready to take them all at once, or would you like them one by one?
All at once, please.
Alright, so then I'm just going to use either a spoon, or I would put it directly up to her mouth and give her all of her medication. And then I would give her some liquid and make sure that she swallows it. And she has swallowed it, so then I'm just going to take everything back and dispose of it properly. And then I'm just going to document that I have given her her medication. And that should be it.